Hello, everyone. The Coordinating Center for the National Drug Early Warning System, sponsored by the National Institute on Drug Abuse, is pleased to welcome you to our June NDUS Presents webinar. The NDUS PI is Dr. Eric Wish, and our NIDTA project scientist is Moira O'Brien. I believe that both of them are in the audience with us this afternoon. My name is Erin Artijani, the NDUS COI, and Barbara Kerr, Marwa Al-Nasir, and I will be the facilitators for this webinar. We are all a part of the NDUS Coordinating Center team, which is based at Caesar at the University of Maryland in College Park. For those who are interested, you can find detailed information about NDUS, recordings of prior webinars, and invitations to future webinars on our website at ndus.org. You will also find instructions for how to join our NDUS network and participate in ongoing discussions with more than 1,500 experts and concerned citizens from across the United States and many other countries. We developed the NDUS Presents webinars to work with leading substance use experts to explore timely drug-related topics and innovative data sources. This month, we are excited to be joined by Ms. Aliese Alter and Ms. Lauren Whiteman from the Washington-Baltimore High Intensity Drug Trafficking Area, or HIDTA. They will be discussing a valuable data resource, ODMAP, that is used by law enforcement and public health agencies across the United States to monitor local opioid overdoses and build collective partnerships to address the opioid crisis. Ms. Alter is the ODMAP program manager at the HIDTA, and Ms. Whiteman is a public health analyst. This webinar will be approximately 60 minutes long, and we encourage you to submit questions during and after the presentation. Please do not raise your hand. Please instead post your questions in the Q&A box. If you raise your hand, we won't be able to call on you or respond to you that way. So it's much better to use the Q&A box. And we will hold a Q&A session after the presentation. During that Q&A, Ms. Alter, Ms. Whiteman, Barbara, Marwa, and I will do our best to get to all of your questions and topics. And a recording of this webinar and a copy of our presenter slides will be made available on our website, which again is www.ndus.org, ndews.org. Thanks again for joining us, and we hope you enjoy this webinar. So I'm going to turn it over to you, Ms. Alter and Ms. Whiteman.
Great. Thank you so much, Erin, for that introduction on ODMAP, and thank you so much for having us on this month's webinar. Today we're going to cover a little bit about ODMAP, both from just a macro level perspective and also taking a look at how localities have established best practices to use the data in ODMAP. But before diving into that, I wanted to make sure that I discussed a little bit about the HIDTA program for anybody who is unfamiliar. The HIDTA program is administered out of the Office of National Drug Control Policy, or ONDCP, and it really works to facilitate information sharing from local up to federal law enforcement, as well as also provides prevention and treatment resources in specific areas of responsibility. Our HIDTA specifically is the Washington-Baltimore HIDTA, and we serve Maryland, West Virginia, DC, and Virginia. I'm going to hand it over to Lauren just to touch a little bit on the overdose response strategy, which is situated within HIDTA in a unique partnership with CDC, as this partnership has been integral to propelling ODMAP nationwide.
Thank you. So as Aliese mentioned, the overdose response strategy is a partnership at the national level between HIDTA and the CDC. It covers 11 HIDTAs, and that covers 24 states across the country. As you can see in the map below, the dark blue states are those that are involved in the ORS. Currently, it is the East Coast as well as the Midwest. And the goal of the overdose response strategy is really to bring together public health and public safety to reduce fatal and non-fatal overdoses. So working together, the ORS, CDC, and the ODCP have worked on a number of different projects, including one looking to work on local innovation called the Copley Grants, the Combating Opioid Overdose Through Community-Level Intervention Initiatives. And so I'll talk a little bit about some of the other parts of the ORS. So really, there are 4 primary directions to it. We are working with law enforcement, response, treatment and recovery, and prevention. And so we work on 4 primary goals. We want to help with data sharing, really trying to help law enforcement and public health share data together and work with one another. Supporting and promoting evidence-based responses to generate immediate reductions in the number of overdose-related fatalities, and this is really where ODMAP is very helpful, as well as promoting and supporting the design, implementation, and evaluation of different promising strategies that, again, work together with that public health and public safety team, and promoting and supporting efforts to prevent substance misuse and overdose. And so the way the ORS works is each of our 24 states has a public health analyst like myself, as well as a drug intelligence officer assigned to that state. And those 2 partner, and again, they represent that idea of public health and public safety. And so they work together on projects, as well as each works independently with partners across their state. And the goal there, again, is just to help bridge that gap.
So next I wanted to, for anybody who's unfamiliar, talk about the history of ODMAP, what ODMAP looks like, move into some different features that are in ODMAP, and then transition to some best practices. So in fall of 2016 is when ODMAP became a concept, and here in Baltimore, that was also at the height of the fentanyl epidemic. And so at that time, cities and communities were being ravaged with both fatal and non-fatal overdoses. And there was a realization that there was really a lack of real-time data reporting, specifically non-fatal reporting. We found that most communities, states, or regions, that they were tracking fatal overdose numbers and they were reporting those up through the state. However, there is a lag in reporting for fatal overdoses, right? We're still waiting for final numbers for 2018. And so we also, from talking to community stakeholders, found that there was no clear consensus or methodology for non-fatal reporting, which represents just as an important group as fatal overdoses, and also represents a good population as far as sharing resources for prevention and treatment. We were also talking to stakeholders and found that there was insufficient information sharing. So we found that perhaps agencies weren't sharing with other agencies, so law enforcement wasn't sharing with their local EMS or public health, or maybe if that was happening, there wasn't sharing occurring outside of their county, their state, or their region. We also found from talking with stakeholders that there was no consensus on what constitutes a spike. Oftentimes, many agencies or communities would look back at the prior day or the prior week and realize that something abnormal was occurring in the environment. They were seeing an abnormal amount of overdoses, but they weren't really sure what to do. And more importantly, they weren't aware of a method that was in place that could alert them as this was occurring. And so that's when ODMAP came into the idea of a concept. It was developed in fall 2016. It went into a pilot in January 2017, and then ultimately went live in April 2017. Since then, it has grown tremendously, and a lot of that is due to support that we have from our partners, which I'll touch on. But just so that there's an idea on the reach, ODMAP currently has participation in 48 states. There are over 2,100 active agreements between agencies and ODMAP. There are over 13,000 ODMAP users, and unfortunately, there are over 132,000 overdoses that have been entered into ODMAP. As a result of ODMAP's growth, we've been lucky to have support from our federal partners, of course, ONDCP, where HIDTA is administered through, but most recently, the Bureau of Justice Assistance and CDC released a ODMAP statewide expansion grant solicitation, which closes at the end of this month. And that is available to states to apply. The grant is open to approximately 6 states and will fund up to $700,000 for each state to implement ODMAP. And it's not just about implementing ODMAP, right? It's also about those collaborative partnerships that go hand in hand with that, which we'll take a look at the local level with some of our best practices. So ODMAP has 2 different platforms. There's a level 1 platform, which is where data entry occurs, as well as user management, agency management, and spike alert management. So this is what the ODMAP level 1 platform looks like. So this is where the data entry is taking place. Traditionally, this is being completed by first responders when they're clearing up from an overdose. And so the whole idea and concept behind ODMAP is that near real-time reporting, which will hopefully stimulate and mobilize a real-time response, which we'll take a look at later. So again, this is being completed in near real time, so we don't have toxicology at this time, we don't have crime lab data back, it's just off of evidence on scene. And so there's very few fields that are required in order to submit an overdose, and that's for a variety of reasons. The first one is because we are on scene, this is in near real time, we want to make it as easy as possible. But we also have ODMAP open up to a large number of diverse users. So it ranges from law enforcement, EMS, medical examiners, coroners, and hospitals. So ODMAP is available to any government entity serving the interests of public health and or public safety, with the addition of hospital EDs at hospitals in order to capture overdose victims who may present themselves at the ED who is not transported by a first responder. So when you look at the fields that are required to submit an overdose, the first one is going to be a location. And so we do find that most users use an address, but I want to take a moment to pause here and touch on that. So an address, if it is utilized, it is translated to a geocoded location via latitude and longitude, and that address is not retained in the system or on our servers. The only other information in addition to an address that is necessary to enter in a suspected overdose is clicking one of these buttons right here. So you would choose and select whether or not it's a non-fatal or fatal overdose in the corresponding naloxone. You would hit submit, and then you just enter in the date and time. And that's all that's required. You do see here in the middle, there's case information. That is going to be optional information, so you have the ability to enter in case number, age, gender, primary suspected drug, and as many additional drugs that are applicable. You also have those 2 additional fields as well. We do find that most of our law enforcement users are entering that information since they aren't as restricted by HIPAA. The second platform of ODMAP is the level 2, and this is where the data entry takes place, but it visualizes it on a map, and we have the ability to do some interesting and additional filters and features with the map. So this is from our training environment right here, but what you can see on this right here where this cluster is, you can see that there are both diamonds and diamonds and circles. You'll see right here that diamonds represent fatal overdoses and circles represent non-fatal. The corresponding colors correspond with the naloxone administration. You can also see that the overdoses are interactive. And so, for example, we clicked on one and took a screenshot. That's as far in as we can zoom. So we have a general idea of where that overdose occurred, but we don't have an exact location. We also aren't able to see any identifying information about the victim. So we can just see the information of who submitted this overdose. So we can see that this was a non-fatal single-dose naloxone that occurred on April 9th at 11:13 a.m., the county, state, and zip code which it occurred in, and the agency's name and the person at that agency who entered in that overdose. There's also some other features within level 2 that you have the ability to do. We do find that most level 2 users are typically going to be decision makers or analysts. And you have the ability to filter down by state, by county, by zip code. You also have the ability to filter, to add additional data and overlay it within your session as well. So that just saves you some time from maybe logging into another, perhaps ArcGIS and just loading it in right here. And there's also going to be, from whatever filters you select, there will be bar charts that you can actually click on and that are interactive. And so, for example, if we picked to take a look at Baltimore and then a surrounding county of Anne Arundel, it will compile both of those counties that we have selected with the corresponding time frame into charts down here. This is a look at ODMAP participation nationally. So this is available on our website if you ever want to take a look. It's odmap.org. And you can actually filter in here as well by state and county. So if you want to see who's participating in your state or who's participating in your state and county, we'll list all those active agencies for you. And by this map, we define participation by there's either at least one signed agreement in that county or there has been data submitted. So I'm going to hand it over to Lauren, who's going to touch on our ODMAP alert system. We have 3 different alerts, which she will touch on and give a brief overview of how you can create them.
The primary goal of ODMAP is to provide these spike alerts. So it is to alert users when overdoses are occurring, when spikes are occurring in real time, so that a response can be mobilized. So you can set up spike alerts, not just for your own county, but also for surrounding counties. Often when we talk to folks, we recognize that they know where their source city is. For instance, in Maryland, most of the counties that surround Baltimore, most of the drugs come from Baltimore City and go out into the counties. So setting up a spike alert for the city gives a warning to those counties that there might be a bad batch of drugs in the area, and they might expect to see a higher number than usual of overdoses. We also have available on our website, as Elise mentioned, it's odmap.org, a spike response framework. And we developed that really, we found that as we developed ODMAP and started to share it with people, folks aren't used to having this kind of real-time data, so we got a lot of questions about this is great, now what do we do? So we put together this document, and it provides a list of 14 different stakeholders, law enforcement, health departments, first responders, et cetera, and provides some steps for them to take before, during, and after a spike. We also provide some examples from the field, promising practices, just something so that you don't have to start from scratch to give some idea of how to go about responding to a spike. So as Elise mentioned, we have 3 different types of spike alerts. The first is what we started with, our standard spike alert. This is set up for a county. And you can set this to be for fatal, non-fatal, or both combined fatal and non-fatal overdoses. You can, when you set this up and you select your state and county and your incident type, ODMAP is going to provide you with a recommended threshold for what will trigger a spike alert. We use a formula of 2 standard deviations above the mean. You have the option, though, to set that spike alert for whatever you think is appropriate for your jurisdiction. But you can also opt, if you want to use our formula, to have that automatically updated. So in the beginning, you might not have very much data, and that recommendation might not be very accurate because of that, because we can only base it off of the data entered into ODMAP. So if you select that box to automatically update the threshold, that allows you, as more data is entered, for everything to update automatically. We also allow you to set up a statewide spike alert. What this does is anytime there is a spike in any county within that state, you'll get an alert. This automatically defaults to be for both fatal and non-fatal, and it automatically utilizes our formula and updates as well. So when a spike alert occurs, you get a notification. When you set this up, you can register anyone who you deem appropriate to receive these alerts. Typically, you're looking at your police chief, EMS chief, health officer, those folks that really need to be mobilized when there's a spike. So you'll get an email notification as soon as that alert is triggered. As the spike continues, you'll receive updates that you're still currently within a spike. And then once that threshold, the number of overdoses in the past 24 hours drops below that threshold, you'll get a notification that your spike has ended. The final kind of alert you can set up, this is particularly helpful for more rural or smaller counties that aren't seeing a lot of overdoses. You can set it to receive an alert anytime a single overdose is entered. And again, you can do that for fatal, non-fatal, or both. And then every single time there is an overdose within that county, you will receive a notification.
Great, thanks, Lauren. So I'm just going to talk about some local best practices that we have seen, just to kind of maybe spark if anybody was thinking about maybe implementing ODMAP in their community, or they are implementing ODMAP, but they're kind of interested in seeing what other places are doing. And we thought that these were great examples to share because they're multidisciplinary and they involve multiple stakeholders from within their community. So most of these all have press releases out about what they're doing, so you can always go and read more. And we have links on our website at odmap.org if you click on In the News of any press release that's been released surrounding ODMAP, so you can take a look at a large variety of methodologies out there which support it. And so I wanted to take the opportunity to break down what Oneida County, New York is doing. And so I think everybody loves a good hub and spoke model. And so we see here that ODMAP surveillance data is at the hub, and then the spokes are going to be any stakeholder which is participating in their overdose response team or in their opioid task force. And so they had 3 different objectives. And again, if you want to take a look at this later, they do have this publicly. But their first objective was first to implement ODMAP to capture and monitor real-time confirmed overdoses from law enforcement. They then worked to establish a 24/7 peer referral process that would dispatch peer recovery advocates to overdose victims identified in ODMAP to help link them to treatment and recovery. The last objective is monitoring and utilizing ODMAP surveillance data to identify the spikes that Lauren talked about and develop and disseminate coordinated public health alerts in order to notify the public. And so this is how their response is working. So you may have asked yourself when I mentioned that they're using ODMAP to identify the victim. So since there's no personal identifying information in ODMAP, New York, specifically some different communities there that we've had the opportunity to work with, have developed innovative strategies in order to receive that information and offer those victims information on resources. And so since they're working in Oneida County with law enforcement reporting the overdose, law enforcement is capturing it via police report. They're also working very closely with their crime analysis center. And so basically what we find that agencies who are working very closely with law enforcement, they establish basically a standing memorandum of understanding, which we're going to take a look at a second example later. But this facilitates law enforcement transmitting that report over to whoever they're working with at the county, which is going to have the victim's information on there. And so they're able to use that information to connect overdose victims to treatment and harm reduction resources via their peer recovery specialists. And they also have an overdose response team, and they've had some great releases recently on how when they've received a spike alert from ODMAP, they actually mobilize their overdose response team. And so you'll see that's one of their duties. And it's also about informing the public of what's occurring, which we're going to take a look at in a moment. This is some data that they put together to show them how law enforcement overdose has reported, or excuse me, increased just over 3 months. And this is how they released an overdose alert. So they notified the public that they had received a ODMAP spike alert notification of 21 suspected heroin overdoses, which resulted in 5 fatalities over the past 10 days. And so they released this information out to the public, and they also took this as an opportunity to inform the public on behaviors of individuals around them who may be experiencing signs of an overdose. And lastly, also took the opportunity to inform them about the Good Samaritan law. They've done some survey results on how beneficial spike alerts have been, as well as if there was any actions that occurred from that, which you can always take a look more in depth as well. And I just wanted to take the opportunity too to touch on Erie County, New York. It's a very similar model. Erie County was one of our very early onboarders of ODMAP, and so they've been using it for quite some time. So their strategy has been able to evolve. But it's very similar in the sense that the police department is entering in the overdose, and then they have a very close relationship with their public health department. And so what's happening is the public health department is logging into ODMAP level 2, so that national map, and they're filtering down by state and county. So they're selecting New York, and then they're going to select Erie County. And then overdoses will populate, and they can actually look at the past day or week, but they're monitoring it every day. And so when they see that a new overdose has occurred in the county, they have that standing memorandum of understanding with the police department. And so they can actually just email the records department over at the local police department and receive that police report. And then they can, again, identify the victim from there. And so they've been able to take a look at this program over time, and we're hopeful that they will release their most current data surrounding this. However, in the first 90 days of this program, nearly 50% of referrals remained connected to care after 30 days. And so I often receive the question of what does connected to care mean? And so for Erie County, that means that they're connected to resources or they're engaging in some type of treatment. And they actually continue to follow up with whoever they make contact to, even if initially that person decides that maybe it's not the right time for them, they do continue to follow up with them after 30 days. And so you can see from their statistics here, they did start using ODMAP in 2017, and they did see a reduction in deaths and overdose. And of course, that's not just attributed to ODMAP. It's attributed to a variety of things, of course, whatever is happening in the drug environment and the availability of naloxone. But I think that these partnerships obviously make a great impact on the community, which are seen from those first 90 days with the nearly 50% remaining connected to care. So those are some great kind of best practices, and I wanted to transition a little bit to the Application Programming Interface, or API, just because we receive a lot of questions about this. And it's also mentioned in the BJA CDC grant as kind of a preferred method for transmitting data to ODMAP. And this is how we are currently, for example, receiving all Maryland EMS data. So several states do have legislation which supports ODMAP in a variety of different methods. And in Maryland, we receive all the EMS data in near real time. And so basically, ODMAP is connected to that repository for EMS data via an API or a code. And so an API, for anybody who's not a technical person, it's just a method that allows data integration with ODMAP and basically any record management software, whether it's going to be a homegrown system or it's a nationally used system. And there's just some additional information on there. But here's some example of agencies who are currently utilizing the API. So you can see that it ranges from fire EMS agencies to law enforcement, and again, to a statewide repository. Our API does not require any future updates, so when a new release of ODMAP comes in, you don't have to go back and update that API because they are backwards compatible. And then this is just a diagram for anybody who's a more visual person or for any technical people out there on how the architecture is supported for ODMAP. And we also receive the question sometimes, especially when interacting with EMS, about NMSIS. And so since ODMAP connects to diverse populations of EMS, law enforcement, health, EMS does have that adopted standard of NMSIS. Law enforcement, there isn't a similar to NMSIS as far as a national industry adopted standard, but the most similar one would be NEAM, but since it hasn't been adopted nationally and systems aren't using the same standards, we developed our custom API, which is simple to consume across all disciplines. And we've had agencies either implement that themselves with the technical staff that they have on site, or maybe they decide to go through a vendor. It's whichever is easiest for them and which resources they have. And so I just wanted to end on some statewide implementation models. Many of these are either in the process or on the horizon. And so Florida was the first state to pass legislation supporting ODMAP back in May 2017, which was signed by the governor in June 2017. And that legislation surrounds EMS data. The Georgia Department of Health is also working on a strategy as well. And again, there's so many of these, I'm just going to focus in on a few, most of which that are currently off the ground. Illinois was one of our early onboarders in the Aliese grant opportunity that they had of between the Illinois Law Enforcement Alarm System, or Aliese, and the Illinois Department of Public Health on empowering and equipping law enforcement and communities in rural Illinois to reduce opioid overdose. And so they were equipping first responders with naloxone, and one of those requirements within that grant was to onboard with ODMAP. Additionally, within the past month, Senate Bill 1258 has been passed through both houses and is currently pending the governor's signature, which supports ODMAP as well through the state. We're currently working with the Maine Department of Health and Human Services on implementation of ODMAP throughout the state. and specifically right now working on onboarding law enforcement first. We've already talked about Maryland. I also wanted to touch on Minnesota. This started in March 2018 when the Nevada Attorney General announced the formation of a statewide partnership on the opioid crisis. And one of their responsibilities was having a ODMAP subcommittee tasked with statewide implementation of ODMAP. And so we've been working really closely with the Nevada Attorney General's office as well as their Department of Health. And we're actually traveling out there next week for anybody who's going to be there to have kind of our first kickoff meeting. But they've done a great job at being able to go out and conduct outreach within their state. We've also had a great close working relationship with the New Jersey State Police Drug Monitoring Initiative, who is working closely with the New Jersey Attorney General's office, and they are actually onboarding every single law enforcement agency, to include the state police, onto ODMAP. West Virginia passed their Senate Bill 520, which mandates ODMAP reporting, and that just went into effect this month, and so this is in the process of getting off the ground. But we're really looking forward to it, especially with such a robust data set that ODMAP has in Maryland. So it will be great to have that with West Virginia as well, since they border. And so I really wanted to end there with those statewide implementation strategies and those best practices, because you can see that they vary so widely, because what works for one state may not work for another state, and the same with local communities. And so these are just some examples maybe to get some ideas flowing, but there will continue to be different strategies and methods that work best for that community or state. And I, again, just want to thank everybody for joining today. I think there are a couple of questions which Erin will help us facilitate, and we're happy to answer.
All right, thank you very much. We really appreciate your presentations, Ms. Alter and Ms. Whiteman. I think you provided us with a great deal of valuable information. And yes, we do have a few questions that have been coming in. So I do want to take a few minutes to run through those. And so our first question is, if we are located outside the current ODMAP area, how could we obtain it within our state?
So great question. ODMAP is available throughout the U.S. And so if you're located in the U.S. and you are a government affiliated agency, you can just go to odmap.org. You can click on agencies, and there will be a request agency access button right there. So just fill out the required information, which is going to be information about your agency. It's going to be who's authorized to sign on behalf of that agency. So for example, if we're looking at a police department, typically it's going to be a chief of police or his or her designee. And then it's going to be an admin that you must designate. So when any agency comes on board to ODMAP, they also designate an admin. And an agency can have as many admins as it likes, or that would make most sense for that agency. And that admin has the ability to disseminate information on how to register other users in your agency, register for spike alerts, etc. But again, just go to odmap.org, click on agencies, and you'll see it. And you can also click on training if it's if it's a lot of information. We'll have our training manual on there that will walk you through those steps as well.
Okay, thank you. I'm sure that was helpful. And our next question is, do you reconcile in real time multiple reports for the same incident?
Yes, so that is a great question. So ODMAP does have duplicate detection built into it. And so it works for a variety of different methods, depending on if it's manual submission or an API submission. But what will happen is, say that I am police and then you are fire EMS, and we're both on scene of the same overdose incident, and say that you enter it first. And then I go to enter it because for whatever reason, I didn't realize you entered it, or I forgot whatever our framework was that we had in place as far as who's going to enter what. As soon as I enter it, actually, it will say possible duplicate submission detected, and it will show me your EMS agency, your name of who just submitted it. So if I was just on scene with you, hopefully it would prompt me, no, I don't want to enter this. He's already taken care of this, or you know what, this is a completely separate incident because we responded to multiple overdose victims in that same general location, so I want to go ahead and submit that. There's also duplicate detection that occurs between the API and manual submission as well, which is a little bit more detailed, but it occurs within 1 hour of the incident and within 285 feet for any type of duplicate detection. So I hope that helps answer that question.
Okay, thank you. Our next question is, what happens if a first responder records a non-fatal OD for a patient and then that patient later dies in the hospital? Does the ED physician enter as a fatal overdose for that same patient? Is this patient therefore double counted?
That's also a great question. And so since ODMAP is near real-time data, these questions come up a lot. And so perhaps you are a first responder and you end up transporting them to the ED, and then you hear later that they do unfortunately pass. You have the ability in ODMAP to go back and edit all of your submissions. And so you could just go back and edit it to fatal overdose with the corresponding naloxone. And we also see many agencies do that. So for example, if I record an overdose as a primary suspected drug as heroin, and then I send that information over to the crime lab, and once I receive the results back, they actually tell me it was heroin, fentanyl, and cocaine. Many agencies will go back and edit that information once they receive it.
Okay, and here's a simpler question for you. How do you define an OD spike?
We use a formula of 2 standard deviations above the mean.
Okay, and the next question is from someone who would like to know if these spike alerts are available to the general public or only to organizations contributing data to the ODMAP.
It's a great question. So currently spike alerts, since it is part of the ODMAP platform, you have to be a registered user of ODMAP in order to receive that. However, we have heard of some innovative strategies that are occurring. So for example, in Berkeley, West Virginia, they have a day report center. And so they've heard feedback from some of their persons that were enrolled in that they wanted to be notified when a spike was occurring, so that for a variety of different reasons, which could be another webinar here, that they wanted to be notified when a spike was occurring. And so they actually use a spike alert from ODMAP, and they transmit that out to a different alert system that they have to those people enrolled in their day report center.
Okay, thank you. We are getting a number of questions in now, so I appreciate all the feedback that we're getting. And just to remind you, please use the Q&A box to submit your questions if you have any. And our next question is concerning the states that passed legislation to implement ODMAP. Has there been a common agency or organization that shepherded the legislation to lawmakers?
So yeah, these are great questions. I really appreciate these. So I wouldn't say that there has been a common agency. It really depends. I think so much we talk about champions within states. And so I think sometimes when we receive a champion within a state has information on ODMAP, they really are able to connect through the right channels in order to get that information onto policymakers and lawmakers. So it really just depends, and we look at that still, you know, with statewide implementation models. We will see, for example, in New Jersey, you have New Jersey State Police that's taking kind of ownership over the POC, and then we look at Maine, and it's the Department of Health. It really just varies by state.
Okay, thank you. Here's another question. This is about Connecticut and recent cluster of crack overdoses that they experienced. So the question is, it was only after conversations with ED physicians that crack contaminated with opioids were suspected. How can ODMAP help with something that does not appear to be opioid but is later identified as an opioid?
So that's a great question. I actually saw a bunch of spike alerts come out recently from Connecticut, and I was wondering what was going on there. And so ODMAP, so this is a couple-pronged response to your question. So since ODMAP is in near real time, we really aren't exactly sure what that drug is, right? However, if they respond to naloxone, we probably, it's going to be an opioid. If they don't respond, then maybe it's something like meth. But this is where I think ODMAP, in conjunction with collaborative partnerships, really can help address this model. And so we've seen great partnerships come out from medical examiners and coroners, for example, where if they're conducting toxicology, they're able to transmit that information over to you in a quicker fashion if they see that there has been a spike alert from ODMAP. Hopefully that they would be able to share that information with you on what they're seeing so that you can help triage patients and improve patient care.
Okay, very good. Thank you. So the next question is, ODMAP made available, is the data made available to researchers?
No, currently ODMAP data is not made available to researchers, and that's just because the data in ODMAP belongs to that agency. So the Washington Baltimore HIDTA is just the data steward.
Can you talk a bit more about how thresholds are established that align with what is being seen in different counties and or states?
I guess I'll take the opportunity to emphasize. So the spike alert threshold that Lauren was talking about, so that's based off of data in ODMAP. So the spike alert is only going to be as good as the data in ODMAP, right? So whatever we see in one area compared to another would be reflected of number one, the data that's in there, and number two, whatever that environment's like. So I would expect, for example, Baltimore City to have a higher spike threshold than a rural area in Virginia.
Okay, thank you. And the next question here is, can co-users who are not associated with any specific law enforcement or medical facility submit an alert anonymously?
So submit an alert, I'm assuming submit a spike alert. I'm not sure how that would be facilitated, but if this was around submitting an overdose anonymously, currently no. We would like in the future to be able to open up ODMAP for bystander naloxone administrations and things of that, but currently no, there's not a method to accommodate that.
So this is from a participant who is a part of fatality reviews and those kind of activities in his county, and he comments that they get death data that lists home address, and he wonders if ODMAP deals in any way with the distinction between the location address of the overdose versus the home address of the person.
Great, yeah, that's a great question. So ODMAP, for the location that's used to submit an overdose, it is going to be the location that the overdose occurred, with the exception of hospitals. Hospitals are entering the hospital address location due to HIPAA concerns. And so, no, there is no distinction because there's no other field to enter in another address. And again, that's just because ODMAP does not collect any personal identifying information. But great question.
On the same topic of locations, and this person asks, what is the minimal information needed for location data? Can it be as general as 100 block of Cheyenne Street or just 2 cross streets?
Yeah, so that's a good one too. We get that question a lot from State Patrol. If maybe they're on an exit ramp, you know, how do you enter in that information? So we're hoping to make this easier in the near future, but the best way for you to be able to do that would be if you have like an in-house geocode, or even if it's you know, internet-based Google Maps, but getting that latitude and longitude that you want to use, and you can enter in your suspected overdose via latitude and longitude, via an address, or if you're on scene of the suspected overdose, you can use your device's location.
How specific are spike alerts to location? For instance, does ODMAP help identify neighborhoods where a batch of heroin with a high amount of fentanyl is being distributed?
Great. So currently ODMAP in general operates off of county and state, and so Spike Alerts is operated off of county and state as well. However, we are hoping to pilot in the very near future being able to operate ODMAP in a broader sense, but also in the more smaller sense at a neighborhood level, a township level, and things like that. So we're hopeful that's forthcoming, but currently it's based off of county and state, and you would have to do a little bit further analysis within that level 2 platform to take a look at any trends that are occurring.
Okay, thank you. So I'm noticing that we're getting a few questions coming in now from participants who are interested in what agencies and organizations you're currently working with, and more information about how they can get involved, or how somebody from community outreach or drug education could help. And so I assume they could find that kind of information on the ODMAP website, but if you have anything you'd like to add there.
Sure. So as far as agencies that we currently work with, you can view them all at odmap.org. And in the sense that we work with, those would be participating agencies who are have signed participation agreements with ODMAP. At the federal level, again, we are administered out of the Office of National Drug Control Policy, so we have a great working relationship with them, as well as our friends and partners over at the Bureau of Justice Assistance and CDC, who continue to put out grant opportunities surrounding ODMAP. And then I'll just also add too, since there's been a lot of questions and interest around Spike Alerts, we are working with the Johns Hopkins Applied Physics Lab to help us incorporate some possible predictive analysis surrounding ODMAP Spike Alerts.
Do you know, as a follow-up to that, if any of the other local sites who are entering data, because I know you said they're the ones who own their data and are responsible for how it gets used, do you know if there's any other sites that have been interested in collaborating with academia to dig into the data and do research on ongoing trends or emerging threats or things like that?
Yeah, absolutely. I've heard of several grant applications that have been in response to the solicitations that have been out there that have incorporated an academic partner.
One last question here, which is from a participant who would like to know, what do you all recommend for data that only has a zip code in a state with large areas for each zip code?
So I have had that question previously, and it was from a state that was a rural state, and they collected it by zip code. And so we discussed a couple different ways to do that. Currently, no one is submitting data at that level currently in the ODMAP. So if it's something that's unique to your state or your county, I just encourage you to reach out to us. Our information is on this webinar, and it's also on all of our documents at odmap.org, and I'd be happy to talk about that to see some additional background on that.
Okay, thank you very much. So again, thank you both for presenting for us today. We really appreciated your presentation and all of the information and advice that you've shared. And so I just want to thank all of our participants for joining us as well. And we will be taking a brief break over the summer, but we will resume our webinars in fall of 2019, hopefully with a new one in September. And so keep an eye out for our announcements back about that. And in the meantime, I hope that you will join us on the NDUS network and participate in some of our ongoing discussions there, and a variety of fields, including toxicology and drug policy and harm reduction and a number of other things. So have a great summer, everyone, and we look forward to seeing you again in the fall.